talk about it, we need to share strategies, and let's address it, and let's try to come at it from multiple different directions.
The Day After Corona projects were created to learn about the optimal processes created during the Corona period and to transform them into new and better work practices. The Co-work project was initialized within this process, enabled staff from headquarters who live far from Maccabi's main offices to work another day remotely at locations rented by Maccabi, which offers the facilities necessary for the office to function. By doing so, you gain the comfort and proximity of home while also enjoying work facilities and the opportunities for partnership with others, creating your own network and feel belong. These are some of the actions we took. A workday from home, having learned from COVID period and realizing that we can do almost everything remotely. We mapped the organizations at the level of occupations and cracked tasks that can be performed almost by every sector. We have recently adopted a resilient supporting policy that calls for all districts to achieve the goal of 20% work from home ratio. Populations that could not work from home were obviously excluded.
From our nurses is they're looking for a more personal touch when it comes to their mental health. And what they really wanted was somebody who walked up into their department and just sat down with them and talked with them. And so the things that have been the most effective are things like we have a buddy program where you have someone you can talk to. We are doing what we call a code lavender, where someone can call a code lavender, which means, hey, I'm a little stressed, can you help me out? 2 of our hospitals now have created relaxation rooms so that they have 10, 15 minutes to escape the chaos of the department. And that has been very effective and well received. But I want to say probably what we hear the most that they appreciate is when they get the spiritual counselors making rounds and they can sit and just talk and share about their frustrations and what's going on. Our spiritual advisors were actively here in our departments, taking risks to make sure that our nurses and our physicians and our nurse aides all had someone to talk to and had a relief, as well as they often debriefed in those sessions. And I know our nurse leaders throw a lot of debriefings.
One is related to cognitive behavioural therapy, which is a well-known, well-established method of reducing burnout. It has a medium effect size, so it's not perfect. It's pretty effective. We know that it's pretty good. It's well researched. And this intervention hopes to reduce burnout by providing simple and effective ways to manage stress, such as breathing exercises, using mindfulness, all the usual things that you would associate with cognitive behavioural therapy. And the second intervention is more theory-based, so there's less research around the area. We know that it works, we just need to prove it, and it is less well studied. So that is something called job crafting. And this is a more practical approach than CBT and looks at practical ways we can amend our thinking, our roles, and our relationships within our jobs to improve our levels of burnout. And what job crafting does is looks at the imbalance between the demands of our job and the rewards of our job and tries to shift that balance in favour of the rewards. So again, that's not as well researched, so that is a novel idea and we're testing it at the moment.
We quickly just put cameras in patients' rooms who had COVID, because what we found was after the first surge, patients declined quickly and the nurses were frightened that they would miss something and the patients were scared. By buying some cameras, putting them in the rooms, it decreased the stress of the nurses because they could keep the patients on their wow cameras. They just felt better.
How can technology help? 2 of the issues I covered are addressed by a unique technological tool that we developed in partnership with the startup company Retrain AI. The first is career development. We are providing our employees opportunities to influence and be active about their development within their organization. The second one is the skill gap I mentioned before. Using AI, Retrain offers a database tool that produces a skill-based taxonomy for any position anywhere. By using Retrain database tools, we can identify our employees' main skills and learn about their career opportunities for them, which roles they can fit, and which areas they should work on in development. What do we gain? We can offer employees a rethinking of their career path in the organization and open up new opportunities for them that match their personal skill set. We can identify gaps in organizational or sectorial skills gap and address them in our learning and development programs and be prepared for the future. We also benefit from the creation of replacement benches for various positions in the organizations based on internal forces.
We are running some research at the moment. It's called Uplift. And what happens is it's a 6 weeks course. Each person that comes on the course is expected to attend a 1 hour seminar every week, and they will look at either the CBT or the job crafting elements of reducing burnout, whichever group they're assigned to. That will be in an interactive seminar, so they will be taught skills and they'll talk through, breathing exercises or elements of job crafting. And they'll be asked about their own experiences and to share their experiences and share ideas as well. This is about pooling ideas of how we can improve burnout. Alongside that, we also worked with an industry partner who developed a website to go alongside the Uplift webinars. And on the website, there are skills practices which help the participant to practice those skills that they've learned during the webinar, to help to establish them, to help to practice these skills so that they develop into habit. They become more positive coping skills than potentially the ones that they're using at the moment.
We're losing our leaders at a fast rate. They're in the middle. They've got the financial constraints coming down and the nursing burnout and the stress and the violence in their departments, and they worn out and they're leaving. And so we did some purposeful, we called them trainings, gave them CEUs or, learning points for that, for their licensure. But we spent time with them on their purpose and why do they do what they do, and talking about stress management for themselves and not necessarily what they could do to take care of their teams. We're all going to do this together. So you had that kind of push to go for help.
Technology can greatly help reduce workload and provide teams with the tools to better self-manage and self-care in challenging work routine. These include technologies for documentation, infrastructure platforms, support in coping with mental stress, consultation platforms, streamlining clinical and administrative process, training, and more.
I think it can help. I don't think it can work alone. We know that delivering CBT via technology alone, there's a huge amount of dropout. People don't tend to stick to what they're needing to do. That doesn't tend to work as well. So I think you need that personal element. But we do know that the CBT is more effective if you include elements of technology as well. So there is a place for technology.
We continue to work on efficiencies in documentation for the EMR. I think uses of scribes and voice technologies that we could start to do where it's almost ambient listening, but it's also scribing for the nurse or the physician. Those are very expensive technologies. Also, communication tools in all of our traditional ways of communication via email or memos or video, they don't have time for. They can barely get through their day. And so anything that allows us to communicate information. Nursing staffing is extremely complex. The traditional analytics just don't really work well as we struggle with even understanding the workload of nurses. We're still doing nursing hours per patient day. We're trying to get to something that manages or demonstrates productivity. We don't have it. And those are tools that could help us make our case. We always struggle with our cost. Even though the hospital can't do it without us, we are a huge labor expense.
This event is an invitation to health systems and startups to collaborate. Together, we can address burnout challenges faced by teams. We believe that bringing the two sectors together will make the difference. We are here to introduce startups with the health system challenges, which are global, not just Israeli, and work together to create a work environment that is both adapted to the fast-paced advanced medicine and balanced for the benefit of healthcare workers. Health organizations across the entire system are partners in the national program and the survey. They are committed, ready, willing, and equipped with the relevant data. They understand the challenges and they know the trends. I am happy and excited about the extensive response and your participation in the meeting today. With relevant partners, information mapping, and a dedicated budget to support projects in the field, I have no doubt that today's meeting will lead to new partnerships and creative solutions for burnout in the healthcare system. We all stand to benefit.
So this is how we see the future for our caregivers to get the best opportunity to do their best. So it's one small technology step for you, but it's a big step and a big help for us.